I'm Dr. Stream, a board certified family medicine and sports medicine doctor. In this video, we're going to discuss about what is platelet rich plasma, also known as PRP, and we're going to explore the role of PRP in osteoarthritis treatment. So without further ado, let's get started. Now first, let's understand arthritis. So let us say if a person has arthritis, they're going to present with pain in the affected joint. For example, let us say if a person has knee osteoarthritis, they're going to have pain in the knee joint. So let us say if the person has a hip osteoarthritis, they're going to have pain in the groin area. Or let us say the person has shoulder osteoarthritis, they're going to have a deep aching pain inside the shoulder joint, and that is usually worsened with movement. So what one has to understand is that arthritis occurs due to chronic inflammation inside the joint, and this could be due to genetic factors or environmental factors such as poor eating habits, smoking, or mechanical factors such as overweight or obesity, causing increased stress on the knees and hips. So this inflammation causes joint destruction, which initially may show up as joint space narrowing and the formation of new bone called as osteophytes, and they both lead to pain in osteoarthritis. So one key thing to understand is that osteoarthritis is different from other types of arthritis, just rheumatoid arthritis or psoriatic arthritis. The rheumatoid arthritis and psoriatic arthritis is due to autoimmune destruction of the joint. So basically what happens is that our own body thinks our joint as foreign and they start attacking the joint. So typically osteoarthritis treatment focus on physical therapy, weight loss, the person has knee osteoarthritis or hip osteoarthritis and they also have overweight or obesity, healthy eating habits, and anti-inflammatory medications. So however, if the pain persists or worsens, then a cortisone injection might be recommended. So cortisone is an anti-inflammatory medication, and injecting directly into the joint can help reduce inflammation and pain. But a key thing to understand is that the cortisone injection helps to reduce inflammation within the joint, but they do not alter the joint's biology. In other words, they temporarily relieve inflammation, but they do not prevent it from recurring. So they do not provide long-term solutions to control excessive inflammation. The potential for cortisone injections to worsen arthritis is still under investigation. The other way to think about it is that let us assume that inflammation is fire. The cortisone injection acts as a fire extinguisher. But the cortisone injection does not do anything to prevent the fire from happening again. But in my opinion, it can buy time. So for example, I had a patient with severe knee osteoarthritis and he used to get injections every 3 months. And sometimes the injections would not even last for more than 2 months. But then he was also suffering from obesity. He was having a very poor eating habit lifestyle. So we changed all those things and he started losing weight. And now he gets these injections like once a year or so. So basically he has changed his lifestyle and thereby helping to prevent the fire from happening again. And the cortisone injection can help to extinguish a fire when the fire is like too much or so. So however, despite trying all these various lifestyle approaches, some individuals still experience arthritis pain. So to prevent the recurrence of inflammation, what measures can be taken? Are there ways to change the biology of the joint, thereby there is less ongoing inflammation and more healing of the joint? So this is where PRP or the platelet rich plasma comes in. So the PRP is made from a patient's own blood, which is centrifuged to concentrate the platelets and leukocytes. The platelets are rich in components like growth factors, serotonin, and ADP, and they all help aid in healing tissues. The studies show that the platelet concentration should be at least 5 times the baseline. The biggest problem that we have is that we don't have a standardized PRP concentration yet that can achieve consistent clinical results. In addition to that, the PRP centrifugation machines can be so much different. So for example, like not all centrifugation machines can provide the optimal concentration of platelets that can provide a good clinical healing. So for example, let us say I'm going to administer a cortisone injection to 10 of my patients. On all 10 of my patients, I'm going to administer the same medication dose. So which means that there is a good consistency among the treatment that I'm providing. However, with PRP, it's going to be a lot different. And again, it is based on the patient's baseline platelet count. In addition to that, there is also a variability in the machine that can provide the platelet concentration. In addition to that, the plasma not only contains platelets, but they also contains leukocytes, which is also called as the white blood cells. We just don't know whether the leukocytes also helps in healing for osteoarthritis or not. At least for knee osteoarthritis, we have come to a consensus that leukocytes should not be in the platelet-rich plasma. However, there's still an ongoing controversy whether the leukocytes can actually be helpful in knee osteoarthritis. So what we understand is that PRP can work by controlling inflammation and they can attract growth factors that promote stopping the destruction of the joint and thus slowing the progression of osteoarthritis. While there is not yet definitive evidence that PRP can regrow cartilage in humans, it has been shown to decrease catabolic factors, basically the factors that degrade cartilage and bones, which can cause worsening of osteoarthritis. However, the use of PRP for osteoarthritis is still a question mark. For knee osteoarthritis, there is a good consistent evidence to show that PRP can actually work for knee osteoarthritis, but for other osteoarthritis like hip osteoarthritis, ankle osteoarthritis, shoulder osteoarthritis, we still do not have consistent evidence to show that the PRP can actually work for these conditions. So in the United States, the PRP treatment are not covered by insurance. So basically this means that one has to pay cash in order to get this treatment, and the cost can vary depending on the practice. Overall, the procedure itself is safe in experienced hands. However, the biggest downside is that let us say if this treatment doesn't work, then the money spent on the treatment is basically lost. So if you do consider PRP treatment for osteoarthritis, make sure that you find a doctor who has expertise in doing these injections, and make sure that they have the machine that can provide the right platelet concentration that can deliver clinical results. Okay, I hope this video is helpful. If you have any questions or comments, please post in the comment box below, and I'll see you in the next video. Until then, goodbye.